What if I told you that this is public health? Public health is population-level health and science. It's about our food, our genes, preventing our sickness. It's about our global society and cultures, and yes, even our cows. Public health is important because it improves our quality of life and promotes the wholeness of the person, the community, and even the larger society. In addition to filling in gaps in medical care delivery and diseases surveillance, public health might improve our food supply and nutrition. It might result in better sanitation and access to water. Something which excites me about public health is that it is necessarily interdisciplinary. For example, public health is directly involved in housing and rural and urban planning. It's big on right to resources and social justice. Although grounded in science, public health is inherently political in the interest of public communities it serves at the local, national, and international levels. Here are several examples of public health in action. I grew up in two rural farming and ranching communities where chronic conditions like cancer and heart disease, less access to timely or affordable medical care, and lifestyle conditions have conspired against public health in many ways. But I've also seen such actors as the University Extension System at work conducting equipment safety classes. There were dental intervention and reproductive health opportunities at my schools, and rural economic development efforts tried to foster an increase in local produce consumption. I was also introduced to more public health interventions in the communities of my neighbors, students, and colleagues on the Rosewood Sioux and Pine Ridge Indian reservations where chronic disease and mental health issues are also prevalent. Addressing disparities are a huge priority of public health today, and the high mortality and morbidity rates of Native American populations continue to be debated. Public health is also important in the Balkans and Eastern Europe. As a post-conflict society, the Balkans' public health infrastructure must not only manage to help the medical system modernize and improve access in rural areas, but it will have to be savvy alongside peace-building efforts, especially in multi-ethnic or divided areas. In 2014, parts of Serbia, Croatia, and Bosnia were overcome with floods, which stimulated an uptick in research about how the region might go about developing a long-term coordinated emergency response system. The World Health Organization also published an epidemiologic analysis of the region which pointed to, among other things, many social determinants of health which needs follow-up. The field is only yet burgeoning locally. Public health in sub-Saharan Africa also covers a large spread of priority areas such as inequalities in healthcare access and outcomes, and a shift in disease burden from infectious to non-communicable. Still, the region unfortunately bears a disproportionate burden of infectious diseases such as HIV and TB and other neglected tropical diseases. Literacy, nutrition, and maternal and child health remain important areas of intervention, and there's also a political element as countries seek to own their own healthcare programming. Access to water is also a high priority area across Africa and increasingly around the world. Though daunting, this list is like a roadmap to improved population health, if you will, and requires a resilient, innovative, and united effort. These are only 3 examples of public health in action in only 3 areas of the world. As you can see, public health is extraordinarily cross-cultural, far-reaching, interprofessional, and interdisciplinary. I find this empowering for our world and our health.